Gallstone formation refers to the development of a calculi in the bile duct. There are various risk factors that increase the risk of developing gallstones, including chronic hemolysis, dyslipidemia with a high cholesterol consumption, as well as a deficiency in bile solubilizing substance like nicotine and bile salt. This condition is particularly prevalent in women over 15 years old. We forget to say that some lifestyle factors can increase the gallstone formation, such as high-calorie diet, obesity, metabolic syndrome, and the lack of physical exercise. Additionally, certain medications including estrogen-containing contraceptives, immunosuppressive drugs like cyclosporine, and hypocholesterolemic agents may increase the risk as well. In some cases, underlying intestinal disease like Crohn's disease or previous ileal resection can be associated with gallstone development. Finally, cirrhosis can also contribute to lipid metabolism dysfunction in the liver, leading to an increased risk of biliary stasis complications. Diagnosing gallstones is often challenging, as they are asymptomatic in approximately 80% of cases. Consequently, they are frequently discovered by luck during an abdominal ultrasound examinations, performed for other reasons. However, about 5% of cases may present with complications. The most common symptoms of uncomplicated gallstones is hepatic colic, characterized by a sudden onset pain in the right upper quadrant in 1/3 of cases, or epigastric region in 2/3 of cases. The pain might radiate to the right shoulder or exhibit a hull belt pattern. It is typically triggered by meals rich in fat and may be accompanied with nausea, vomiting, or decreased deep inspiration. The duration of pain is usually less than 6 hours, and there is typically an absence of fever and jaundice. On your physical examination, you will find a tenderness or pain in the right hypochondrium, and the Murphy signs may be positive. The Murphy sign refers to the production of pain upon deep inspiration during palpation of the gallbladder area. Paraclinical examination, although they are not sometimes necessary, such as abdominal ultrasound, play a crucial role in diagnosing gallstones. Ultrasound imaging can reveal the presence of hyperechoic solidarity or multiple calculi with posterior acoustic shadowing. It can also identify dilation of the bile ducts. Abdominal computed tomography is particularly useful for detecting complications, including cystic duct obstruction leading to acute or chronic cholelithiasis, obstruction of the common bile duct resulting in cholestic syndrome characterized by dark urine, poor stools, and pruritus, as well as an obstruction of the Rare-Song duct leading to a severe and potentially fatal complication called acute pancreatitis. This is a very severe complication, so we'll talk about it in details in a separate video. Now let's talk about the treatment. Treatment for uncomplicated asymptomatic in the gallbladder typically does not involve cholecystectomy unless the patient is at risk, but it is recommended with systematic histopathological examination. In symptomatic cases, pain management with antispasmodics and analgesic is the initial approach, and the treatment for complicated gallstones varies depending on the specific complications present. Thanks for watching.
Bye.